And the thing about TEFCA is the patient experience. When you start comparing that to this portal authentication mechanism, it's so incredibly clear that it is a much more patient-centric, a much more friendly mechanism for an individual to consent and share their medical records, right? All they essentially have to do is verify their identity using an ID verification platform like Clear or ID.me. So they take a photo of their face, take a photo of some government issue ID if the platform doesn't know who they are already. And then they basically click and specify which institutions they want to share their records from, because what we do with that verified identity is we actually federate a request out to the TEFCA network and say, hey, who knows about this John Doe that lives at this address with this birthday? And we get back a response of eventually probably a half dozen to a dozen different institutions that know about that individual. And then we give the patient the ability to say, yes, these are the institutions that I want to share with my personal health record app, with my clinical trial, with my care coordination company. That experience is fundamentally it's leaps and bounds better than having to say, all right, remember all the institutions you've been to, find them in a catalog that might actually be a subset of all the institutions that you actually visited. And then remember your username and password, log in, and then go through an experience. And we haven't talked about this, but every EHR actually controls the consent flow within, and it's going to differ significantly depending on the EHR that the hospital or health system uses. So Epic's consent flow versus Cerner's consent flow versus Athena versus Allscripts, they're all different.